What is a sexual health policy and why does every assisted living or long term care community need one? So, a sexual health policy is a statement of values and a set of guidelines that informs a community culture regarding a resident's right to self determination. And specifically, a sexual health policy lays out guidelines and a statement of values about a person's right to sexual self expression. So, in the Western world, adults have the right to sexual self expression. When questions surrounding diminished capacity, like how our brain changes over time in the context of dementia, and that may influence our ability to make decisions and understand consequences about certain actions, like managing money or driving or making medical decisions or having intimate relationships. When questions about capacity come up regarding sexuality, there can be lots and lots of questions with no clear answers. And so a sexual health policy really helps to say the value that the long-term care community or the assisted living community has. Like, we have a value here that we honor the sexual self-expression of our residents. We understand that people pair off and form intimate relationships. This is actually human and healthy. And we also understand that in the context of dementia, there can be many consequences and concerns. Can the person consent? How is consent determined? What if one partner can consent and the other cannot consent? What actually can people consent to? And so the sexual health policy lays out guidelines for how do we determine consent? How do we respond when questions come up in the community? And so on. A sexual health policy can be shared with residents. A sexual health policy can be shared with families. And a sexual health policy can be shared with staff and provide a pathway and provide guidance for how you, as a long term care community or assisted living community or professional, will help the community to respond to many of the dilemmas and complexities that come up with sexual expression. So it does two things. It helps to honor rights and dignity and sexual autonomy of residents, and it helps to provide guidelines for what to do when questions arise and dilemmas arise. I'm Dr. Regina Koepp. I'm a board certified clinical psychologist. I'm a clinical geropsychologist and founder of the Center for Mental Health and Aging. My mission is to make sure that every long-term care and assisted living community has the tools and resources you need to maintain the rights and dignity and honor the rights and dignity of people living with dementia, including sexual health, and navigate complexities and dilemmas that come up when we consider dementia and sexual health, like capacity to consent and like our duty to protect people from harm. So tell me, does your community have a sexual health policy? If so, what does it say? How comprehensive is it? Tell me about the sexual health policy that you have.